Shannon Watkins. I am here today with Professor Sean Mulholland, who recently authored a working paper entitled COVID-19 Prevalence and Empty College Seats. Professor Mulholland teaches economics and is the Associate Director of the Center for the Study of Free Enterprise at Western Carolina University. To start off, Sean, you preface your research with some data about why students might decide to put off college right now in the midst of COVID-19. What are some of the main reasons high school seniors say they are likely to delay their college education?
Thank you, Jen, for that introduction. I'm honored to be here. It's a pleasure to chat with you today, and hopefully others that want to learn about what's going on in higher ed and the coronavirus as they kind of intermingle and overlap each other at the moment. Yeah, so if you look at a number of surveys, you'll see that the surveys suggest that about a quarter of high school students are reconsidering, and this is basically in April, were reconsidering their choice of where they were planning on going to college. The top three reasons, number one was they were thinking about being closer to home. So they were reevaluating, especially those who were thinking about going further away or thinking about being closer to home. They were thinking worried about losing their tuition dollars. And I think that's something to do with potentially either moving from one college to another, realizing it wasn't their the ideal choice for them, the ideal place for them, or it had something to do with, would they kind of lose the entire academic experience and kind of relive what they lived in high school was to go and learn at home as a college student. And the last one, which represented about 20% of those who were reconsidering, was just they were worried about actually contracting the virus. And so all of these are kind of culminating in this kind of uncertainty over what the fall is going to look like for them. And so this kind of kicked off, one of the things that I was concerned about is kind of what the fall is going to look like. As a professor, we're still debating whether we'll be online, whether it will be a hybrid, whether it'll be face-to-face, what face-to-face might look like or even mean. And so I kind of wanted to get an idea of what students and parents were thinking. And these survey days are really great, but it oftentimes, survey data kind of loses some punch because it doesn't really have a revealed preference. Like, what do they actually end up doing? And so that kind of pushed me toward this study and how I went about collecting the data and implementing it.
That's great. Well, I was just about to ask you about what motivated your particular studies, but you felt that there was something lacking in the survey in terms of what students' actual decisions are likely to be.
Yeah, I mean, I think, we're getting kind of dire, information daily about institutions that are either, furloughing staff and faculty or laying off staff or faculty. Many states have, cut the budgets because of lack of tax revenue, when the combination of people cutting back, which they would have anyway with the virus, on top of the government closing a lot of economic trade across the United States, has caused a reduction in tax revenue. It's caused a loss of jobs. And so the combination of parents and students with less income, schools with less dollars coming from states, especially for public schools, and private schools endowments falling, has caused this kind of ripple effect of, well, what is the fall going to be like for the universities? And of course, this is going to add to the angst of any student. And so, but I was I see that as like kind of a universal effect, right? So all of these institutions are experiencing a downturn given the lack of revenue, given the lack of income. My question was kind of a more precise question, which is the virus itself or the risks associated with the presence of the virus itself affecting the students' decisions as where they would actually put their dollars, where they will make deposits?
Great. Thank you for that background. So let's talk about your study. How did you conduct your research and what data did you look at?
So I was trying to find data on, ideally we'd have data on enrollment, kind of the number of students who are actually enrolled, but we won't have those kind of hard data until the fall at the earliest, and usually those don't come out through the IPEDS, the agency that collects this the National Center for Education Statistics until usually in the spring. So what I want to do is find data on new freshman enrollment deposits. Well, that's hard to do, but there's one organization, the National Association for College Admissions Counselors, that every year posts like a bulletin board where colleges and universities can basically signal out there that after the May 1st deadline, which is the typical deadline for students to decide whether I'm going to deposit or not, they can signal that they have open seats. They also can signal information about whether those seats are for first-year students or transfers, and whether they have available housing, and whether they have available financial aid. And so every year, the NASAC, or however you want to pronounce it, the National Association of College Admission Counselors, has this bulletin board. And it just so happens that last year I was collecting it just because I was thinking about another question, because every year they basically overwrite the data on the website. So you can't go back and find past years. I just happen to have 2019, and I had some dates of when they were kind of posting these. And then I said, well, I'll have that again in 2020. And so what I do is I look at kind of the schools that said they had open seats in 2019 and compare that to the schools that have open seats in 2020. And so what I'm doing is I'm looking within schools. So fundamentally what I'm asking is, Young Harris College just down in Georgia had openings last year, freshman seat openings last year, but this year they don't. All right, so that's a switch behavior. And so kind of the estimation or the information I'm picking up is, did a school switch its behavior from being either having openings last year and not this year, or did they not have openings last year and then announce they did this year? Just looking at the raw data, there's been a huge jump in the number of institutions that are reporting openings. But again, I was wanting to focus on whether or not there were deaths within the county where the school was located due to COVID-19, or cases due to COVID-19, and whether that actually had some relationship to the probability of this year saying that they had openings.
Right. And there was another, so you also looked at cases too, correct?
Yeah, so I wanted to look at, the cases data was the one that was jumping out at people as we started implementing testing, right? So initially there was this big kind of, oh no, look at the rise in cases. But of course, the problem with the virus is that if, so many cases, so many of those are going to result in deaths.
Right.
The other problem with cases is there's kind of like, non-uniform process of who was eligible to get a test, how the tests were implemented. We're finding out now that they were mixing both the tests of whether you have an active virus or whether you've had it in the past, and whether you've had it in the past. So they were combining those as cases. So the case numbers were kind of out and about. And so I want to look at cases because that's the best information that these students and parents had. Even if they were wrong, those were the information that we had available to us. Mm-hmm. The benefit of looking at deaths is that they're hard to miscount. A death is a death. Now, it's easy to miscount what's the cause of death. Mm. It basically have some reasonable ways to go about assessing whether this was at least related to COVID-19 or not. And so, but again, even if there was an error in how we go about measuring it, that was the information that the students had. And I particularly wanted to look at the death and case rates by county on the May 1st date, because that's the deadline when students have to deposit. So that's basically the closest I could come to the last day of information that would be available to someone making the decision. And also the third way, and we'll talk more about this, the third way is I looked at the growth rate. So it may not be so much that people are worried about the number of cases today, but if all a place that was growing in cases, they might be concerned about what it would look like in August or September.
Interesting. So with all this data that you're looking at, what were your main findings? And what can you draw from them?
Oh, sorry, go ahead.
Yeah, well, what were your findings, the main findings that you found, and what conclusions can be drawn from them?
So, the three main measures I was looking at were just basically number of deaths and number of cases, number of deaths and number of cases per 100,000, some kind of risk of exposure, and then the growth rate in cases. It turns out the story is very similar across all three. So let me just kind of briefly touch on them. If I just went out and I looked at kind of the number of deaths, and I did a 1 standard deviation increase, so that would be about 372 deaths. I saw about an 83% increase in the probability that a school located in that county would report openings. So what does that mean? So one way to think about this is to look at a couple of like areas in North Carolina. If I was to look at Mecklenburg County had at the time about 50 deaths. And so Mecklenburg County, if I then look at my estimate, a school in Mecklenburg County had about a 9% higher probability of reporting openings for freshmen, housing, and aid than a school located in a county that had none. So for instance, Western Carolina University was in Jackson County, had none at the time. And so what I can do is I can say, hey, a place that has more deaths at the time of that decision day is associated with having a higher probability of reporting openings. Now, there's a couple other things going on in the background that I guess I need to talk about, and it's in the paper as well. And that is that in real time, some of these institutions were actually changing their decision day. Many of these schools, because students couldn't visit them in the spring, and because they knew there was this concern about what the fall would look like and whether students would want to go close or further away, some schools actually adjusted their deposit deadline. The majority of them moved it to June 1st. Some of them were to May 15th, some of them were June 15th, some of them were as late as August 1st. And so what I needed to do is I also went back and I said, okay, let's account for those. So let's basically go in and say like, well, what's the probability that a school posts that they have openings given the number of deaths in the county, and accounting for the fact that some institutions, for that particular institution, whether or not they've changed the day, how many additional days they gave students to decide whether they would deposit there or not. And basically accounting for that change in the admission day, the decision day, the decision deadline, it still resulted in, for every 1 standard deviation increase in the number of deaths, about a 65% increase in the likelihood that a school would report opening. So even adjusting for that kind of delay, the possible delay, I still see an increase in the number of the probability of openings when there's more deaths.
Wow. So what does this mean for how colleges should expect to react in the fall and in the future?
The Chronicle of Higher Education is tracking whether schools will open face-to-face, or whether they're planning to open in hybrid, or whether they're planning on doing everything online. The majority, although it's not a huge majority, the majority of them are saying face-to-face. And I think, number one, what schools are trying to say is you're not going to lose your tuition dollars, and you're going to get the full experience, the full college experience. You'll have interactions with student groups. You'll have interactions with your faculty in face-to-face. You'll have the full kind of, the full gamut of what face-to-face on-campus college experience is like. So they're trying to alleviate one of those concerns. The other thing I think that universities will start doing, and you're starting to see it now, is you're starting to see them put together proposals of what face-to-face looks like as they're coming up with ways to reduce possible transmission, right? So, there's a lot of discussion going on about, well, can we actually trace these students over time? And it's like, well, they're probably going to be interacting with students across campus all the time. Can we at least make the academic learning experience such that, and they're sitting in the same spot in a way that reduces kind of risk of transmission and exposure? And so you're going to see a lot of universities basically probably setting up things where, you'll have a class that would hold 50 students traditionally, but they'll only meet with 25 students each time they meet, and they'll rotate which 25 will meet. And so you'll only actually go physically to the classroom maybe every other time. Meanwhile, you'll be seeing the video feed from the classroom in your university residence hall, or in your, nearby the university, so as to reduce kind of how close you are to people during the lecture. I think there's going to be a lot of these things, but I think it really behooves universities and colleges to start putting out what their plans are students can kind of be reassured that they'll get some of that face-to-face, or at least that personal interaction that they expect when there's a face-to-face kind of college experience.
Right. Well, we're both in North Carolina. What is this issue, your findings, what does it mean specifically for North Carolina? And have you heard about how some universities in our state are responding to this issue?
Well, so, I mean, in terms of, posting open enrollments, it's true that a lot of more schools in North Carolina this year than last year have posted that they have openings. So they're clearly seeing a reduction in students putting their deposits.
Mm-hmm.
I've seen there are at the various UNC system schools, each one of the UNC system schools have basically been granted the authority to make some decisions on their own with the goal of having face-to-face. I know that there's been a variety of different kind of planning committees at each one of these, trying to come up with ways to use the resources we have to give some of the face-to-face, but also to reduce risk. So, for instance, there's been discussion, and this isn't fully implemented and fully decided because we're in the process of doing so, but that we'll have, labs will have fewer people. How those labs will be set up will be differently. It may be that not every student participates in every lab exercise. In other words, there'll be more observing of students, but students will still get to participate in some of them. There'll be certain kind of ways in which, we may kind of deliver things both online in real time, but also archive it so students can watch it again, much like we did in the spring when we went to online, but then make sure that we have the kind of interaction that we have face-to-face. So, I mean, that's one of, but I have seen universities, like App State came out really early and said, we're doing face-to-face. We know we're going to do face-to-face. You don't have to worry about that, right? They came out really early on. Other schools have been slower to decide what to do. And I think some of it also has to do with the number of cases that were in your county or your location. Places that have a high amount of risk of COVID-19 being transmitted, well, they might say, well, we're just going to have to do this online. So I think a lot of it is really, focused on the uniqueness of the institution, what they plan to deliver, where they're located, the risks associated, say, the hospital space around them and such. So I've seen like different process, different plans kind of starting to bubble up. But only, a few of them have come out and said, we're absolutely doing face-to-face, versus Western Carolina is still kind of in the process of deciding, and we're supposed to know in the next few days kind of what we're going to do moving forward.
Great. Is there anything else you'd like to share with our viewers about your findings or anything related to this issue?
Well, I mean, I just really want people to understand that the university system, the UNC system especially, has given each campus its kind of own ability to make the decision. And I think that's a really wise decision, because each one of us face different risks, both in terms of educational disruption and the healthcare availability nearby. And that each one of these universities are taking it seriously. And this is true across the United States, across all universities. But I also want students to be aware that most faculty want to be face-to-face, and they want to be building relationships over time with students. And so most faculty will actually find ways to do that, both in person and online. So you will get the educational experience, maybe not the one you're expecting initially, but I think over time what will happen is we'll find ways to reduce the risk of transmission, and we'll see each other face-to-face.
Well, that's certainly good news. Sean, thank you very much for looking into this important issue and for speaking with me today. Appreciate it.
Shannon, it's been a pleasure, and thank you very much for reaching out to me. Thank you. It's been a pleasure.